Now, obesity is a medical condition characterized by an excess amount of body fat, which can negatively impact one's health. Now, it's typically measured by calculating a person's body mass index, or BMI, which is their weight in kilograms divided by the square of their height in meters. Now, a recent survey revealed that 68% of South African women and 38% of men are overweight or obese. And this year's theme for World Obesity Day is Changing Systems, Healthier Lives, and it will run throughout the month of March. And this initiative aims to reshape the conversation around obesity and also to advocate for evidence-based nutrition solutions to prevent and manage the disease. Now, joining us now to help us unpack what this is all about, we are joined virtually by Dietician Sanele Dlamini. Sanele, great to have you with us. Welcome to Morning Live.
Thank you so much, Sakina, for having me, especially when we're discussing such an important topic. Obesity really is a pandemic, and it's time that we view it as such.
So let's start with the causes. What are some of the main causes of obesity in the South African context?
So obesity is quite multifaceted, which is why I always say we need to lead with kindness. You might see someone and in your eyes they look obese, and you are processing that as potentially just an increase in calories and excess and consumption of excess fat and unhealthy foods. But we need to understand that there are also medical conditions that can result in obesity, such as your Prader-Willi syndrome. You also have hormonal changes that can lead to weight gain, certain medications as well. So it is a pretty sensitive topic. But when we are talking about obesity generally, and when we are talking about obesity in the South African context, we then start to look at things such as the poverty life cycle and how poverty can then lead to obesity and what we refer to as the double burden of disease. You also start looking at things such as trends and I'm going to call it family traditions that are passed on from generation to generation. So things we teach our children from a young age that shape their behavior when it comes to food and that shape how they view food. So all these things play a role, and also your environment plays a role. So in the South African context, poverty is definitely one of the leading causes of obesity.
Just explain that, perhaps for people who don't quite follow that train of thought, Sanele, when you say poverty would be one of those causes of obesity in South Africa.
So it's important to understand that currently the South African food basket is 3,600 Rand, which is quite high for many South Africans. So when we look at a child's life, looking from conception all the way to adulthood, you get a pregnant woman who potentially isn't eating right. And this then leads to a child growing up in an environment where they are not getting nutritious food, they are not eating adequately. And yes, we do in South Africa have the school nutrition program, but it's just not enough. And when we look at the school nutrition program, there's the ideal versus what we're actually seeing in reality, and we're not always meeting those targets. So that child is then more likely to depend on foods such as amagwinya or fried chips because they are cheaper and more affordable for the family. And when you look at what they're eating for supper, it's things more like just pap and cabbage because that's what they can afford. So they are lacking in a lot of nutrients. This is someone who later on we're going to see struggling at school, struggling to keep up, someone who at some stage could potentially even drop out because of this. And that cycle then continues because they get stuck in the system of being a low-skilled laborer, and that poverty cycle then continues.
And then what about genetics, Sanele? Is this something that we speak about enough? As you said, sometimes one is quick to pass judgment, but what about genetics and the role that that plays in obesity and affecting metabolism and body weight?
So there are certain genetic disorders that can lead to obesity, but I think when we're looking at obesity generally, And now we're just looking at the topic of genetics. Yes, there are certain genes that can increase your risk 20 to 30% in terms of becoming overweight or obese. But what we need to understand is that genes alone isn't what necessarily leads to obesity. So things such as your environment, what are you eating at home, what are the people around you eating, things such as your behavior with food, your lifestyle, are you active enough, are you being physical enough, how often are you doing that? All those things, and your socio-economic status, and all those things then play a role, and that then leads to what we call obesity. But genes alone, I know we all love to hide behind the fact that we come from a family that has obesity, but genes alone isn't necessarily what leads to obesity if we're looking at obesity generally and we're not looking at genetic disorders.
And when it comes to the health risks that are associated with obesity, Sanele, let's speak to that.
Thank you so much for asking that question. I think that's a very important question when we're looking at World Obesity Day, especially since diseases related to obesity are resulting in 33 billion rand being used annually in terms of health and the health system. So it is something we need to talk about. Obesity does lead to your higher risk of getting diseases such as diabetes and cardiovascular disease. And these diseases, especially cardiovascular disease, are the leading cause of death currently. So we do need to be careful when it comes to obesity and watching our weight. And it can even lead to certain cancers.
And, you know, of the factors that you mentioned and looking at the society that we live in, our socioeconomic conditions, you know, and the opportunities that exist for things like exercise, you know, what sort of advice would you give to people at home who may be struggling with, you know, obesity or just weight gain in general in a society where it's kind of difficult right now to do certain things?
So I worked in rural KZN, and one of the things that I found is a huge problem in our country is access, so access to nutritious food. And I guess my main tip and advice would be we need to go back to our indigenous foods. We need to go back to the things that we know. So utilizing and incorporating things such as amadumbe and imfino in your diet, things that you have access to. Those are actually nutritious foods, as opposed to things such as amagwinya and your fried chips. So we need to look at what foods do we have access to. I know that is something the KZN Department of Health is currently working on actively, making those indigenous foods more easily available to South Africans. But it is something we need to go back to. And in terms of exercise, it doesn't need to be anything strenuous. Just 30 minutes a day, 5 days a week, a little walk. That's all really that you need to do. It doesn't need to be anything hectic. You don't even need any equipment in order to be physically active.
Well, Sanele, some good advice, and that's where we're going to leave it on that tip. Thank you so much for speaking to us, Dietitian Sanele Dlamini, speaking to us about the dangers of obesity and, of course, giving us some tips as well of how to prevent and, of course, continue to live a rather safe lifestyle that would prevent us from being obese. So